Now I want to turn to our convocation speakers in our first virtual convocation. I couldn't think of two people more ideally suited to be speaking to you today. They are Jill Ryan, who is Executive Director of the Colorado Department of Public Health and Environment, better known as CDPHE, and Rachel Herlihy, Chief of the Communicable Disease Branch and also a state epidemiologist. Jill received her MPH from the University of Northern Colorado at the time when that program was the first and I believe the only MPH program in the state. Rachel trained in medicine at the University of Wisconsin and in preventive medicine at Johns Hopkins, where she also received her MPH. So thank you for being here to speak to our graduates today. I'm going to turn to you both to just talk a little bit about your career paths. And Jill, why don't we start with you? Say a little bit about going from an MPH at UNC to the important position you hold.
Thanks, John. I'm glad to be here today, and congratulations, everyone. Yes, so in 1995, I got what I would describe as my dream job in public health, and that was working in the family planning clinic at the Jefferson County Department of Public Health, and really trying to promote those services to people who are underserved, including adolescents. And I came from a background in counseling, and I absolutely loved this job, and I fell in love with public health, and I immediately enrolled in UNC, as you pointed out. It was the only MPH program at the time. The thing that was so attractive to me was I could go to school at night and keep my day job that I was so in love with. Not too long after having that job at Jefferson County, a couple of years, wouldn't you know it, the state invited me to come participate in a very controversial program. It was an abstinence-only program. The federal government was offering this chance for states to draw down a bunch of money, but to fund abstinence only, which we all know in public health, the literature doesn't support as a viable way to prevent teen pregnancies. So that's where I really got a taste of the policy realm and working with diverse constituents and trying to come up with a way to really educate people about public health practice and how to know what's effective while still respecting the values of many different groups. And that was my foray into CDPHE, where I spent 10 years. I founded the Office of Health Equity while I was there. I really gravitated toward health planning and health policy. I left, moved to Eagle County, became the local public health director in 2004. I did that for 5 years, started a family and my own consulting practice. But of course, being in the Office of Health Disparities, now called Office of Health Equity, worked a lot on social determinants of health and became enamored with running for public office. So I could really work on the determinants of health, whether it's affordable housing or access to goods and services and transportation and inequities in income and education. So I ended up running for county commissioner in 2012 in Eagle County and did that for 6 years. And it was really a great way to feed my love of policy and working with disparate populations. And then Governor Polis asked me to come serve as the director of Department of Public Health and Environment, and coming back to really my roots in January of 2019. So I've held that office. I was in it for about 13 months when SARS-CoV-2 became a thing in Colorado. And so that's been my path to sitting before you today.
Great, thanks. And Rachel, why don't you tell us a little bit how you ended up in the hot seat you're in?
Sure. Congrats, graduates. I'm so excited for you. You're certainly entering the workforce at a really exciting and interesting time. So my journey in public health has really been primarily focused in epidemiology. And it was actually during high school that I really fell in love with the idea of public health and being a disease detective. I had read the book And the Band Played On, which was really an inspiration to me and really inspired me to follow a career in public health. And so had a bit of a winding path to get there, like many of us do in public health, but chose to pursue a dual career in medicine and public health. And so first pursued an undergraduate degree in microbiology to get some basic science behind me, and then went on to medical school, but knew the entire time I was in medical school that I really wanted to end up in a public health space. I certainly enjoyed clinical medicine, but it wasn't really what inspired me like public health did. And so because of that, pursued a preventive medicine residency and the opportunity to really learn much more about epidemiology. And through that residency, and that was while I was at Hopkins, also received my MPH. And really, I feel like that MPH training has really been the core of epidemiology for me, and really where I gained the skills and the tools that I needed to be a medical epidemiologist and practice eventually as a state epidemiologist. It was during that time in residency, I was actually talking to the Maryland Department of Health about a potential internship with them, that I said during an interview, whether this was a good idea or not, that I actually wanted to be a state epidemiologist. And I eventually ended up here, and it's been an exciting path to get here. I, right after residency, spent some time working for the Department of Defense and worked on infectious diseases clinical research and gained some great research skills during that time. And then went on to be the deputy state epidemiologist for the Utah Department of Health for a couple of years. And then came here to Colorado and had the opportunity to first start working in immunizations and really gain some understanding of the policy aspects of public health work that we do, before moving into an administrative role, and then now eventually into the state epidemiologist position, where I've been for the last 3 years. And really my passion is communicable disease epidemiology, but as I'll talk more about, I'm sure it's the same set of tools and skills that we use across disciplines within public health.
Great. Well, thank you. You certainly both had varied and rich careers to now, and much more to come. So, looking at our graduates now and thinking about starting in 2020, what do you see lying ahead for them, the challenges they may face and the skills they might need? So I don't know, Jill, do you want to weigh in first, and then Rachel come after?
Sure, John. Yes, so I think it's always exciting to be in public health, but of course, with this novel coronavirus, even a more exciting time today. So, public health is so interesting. The general public, policymakers don't really understand what we do. I think as a field, sometimes we struggle to market ourselves, and the truth is the public simply can't live without us. They will never realize everything that we have prevented, of course. So, I think as a result, public health has been underfunded. The field's been underfunded for decades. And now with SARS-CoV-2, there's just going to be an influx of funding for public health. And, I know it's my vision. I know it's even Dr. Redfield's vision at the CDC. How do we take advantage of the funding that we're getting to really build our workforce, to get people into these agencies and, under the guise of SARS-CoV-2, but then moving into permanent public health jobs so we have a more robust public health workforce. I think the challenge for graduates may be that public health expertise is going to be in high demand. At the same time, these public health agencies are going to be so focused on the response that they're going to be a little bit overwhelmed in trying to get people into the workforce. So I would say my advice would be, you don't have to wait for that perfect public health job. Get your foot in the door at a public health agency, even if it's something like a job for a contact tracer or something. I think once you're in the agency, your skills will become apparent. You can climb the ladder, or go into a different role at some point if it's not in the response. On the other hand, I think there will still be, of course, public health jobs in general available, but I think that's a way to fast track it, is looking for a way into these agencies through the response.
And Rachel, your thoughts?
Yeah, I would certainly echo that. I think, for those folks that are similar to me, whose passion is communicable disease epidemiology, it's sort of an ideal time, right, to be joining the workforce. That's really what our response to COVID-19 is. But I think also keep in mind that what you learn during your education in public health is really a tool set that can be applied to lots of different disciplines. And as Jill said, I think this is really the ideal time to get into the workforce, use those tools that you've developed over the last couple of years. And perhaps there's going to be more opportunities available specifically in COVID-19 response work, but it's the same tools, it's the same skills, and develop those skills now early on in your career, and you'll have lots of opportunities before you. If, perhaps COVID-19 isn't your passion today, it's the same skill set that you need that you can apply to a future passion, whether that's obesity or tobacco prevention or other work that might be out there waiting for you.
So Rachel, I'm going to challenge you now, put on your futurist hat. A graduate in 2020 might easily be working in 2050 or even 2060. What do you think is going to happen to public health? It's not going away, but post COVID-19 and looking to the future, what do you see in your crystal ball?
Yeah, so I do think that, we are going to be in this period of renewed interest in public health preparedness. And we've seen this previously, right, in response to 9/11 and anthrax attacks, and then the 2009 H1N1 pandemic. I think this is the next phase of public health preparedness and response work. And so I think that there's going to be renewed interest in ensuring that our public health agencies are prepared. And I think that step will follow really immediately after this initial response phase. And so I think there's absolutely going to be an investment in public health preparedness that follows this critical initial response period. And hopefully that carries forward into the future and our future investment in our public health infrastructure as we go forward, because I think we all know that long-term investment in all aspects of public health and ensuring we have a broad workforce that can work on a variety of disciplines is going to be critically important going forward.
Thanks for looking ahead. Jill, just turning back to you and your interest in social determinants and you've been engaged in communities, how do you think we're going to do in the future with addressing these root causes that you've been concerned about?
Yeah, John, thanks for the question. Back in 2001, the Office of then Health Disparities wrote the first report on what this looked like for communities, and really looking at each health outcome, for example, by race, ethnicity, and then talking about all the root causes of institutionalized racism or systematic discrimination, and the things that result in disparities in income and education, which lead to the outcomes that you see. I think what COVID-19 has done is absolutely exploit all the weaknesses in our systems and made those disparities simply magnified. And so, for example, African Americans and Latinos have had higher rates of death from COVID-19. If you go all the way back, to the root causes of that, potentially it could be linked to there are more people that are in professions that have been defined broadly across the nation as a critical workforce. Those are people that are going to work each day, whether they're working in a grocery store, whether they're working in Walmart, whether they're driving a bus. They're disproportionately in jobs that you're not able to do from home. And so they have more exposure, and then it, of course, exploits the inequities in access to healthcare. It exploits the inequities in, the disease process that we see that is it's magnified from all of the inequities in society. And then groups tend to have higher rates of for example, diabetes or high blood pressure, or issues that make COVID-19 harder to respond from. So, I think public health has had a lens on this, and the hard thing is us having a loud enough voice, and figuring out what those policy levers are that we can pull that create a more just and equitable society. After coming out of the Office of Health Disparities, I used to say public health people should run for public office, which is what I've done several times, just because I think, we have a different view of the world. That's one small policy lever, but we need some change, right, on just such a large scale to get at these. But I think, we're the right place to start. We understand the data and the root causes, and ultimately, it's the ultimate way to go upstream in prevention, to have the best outcomes and prevent, having to spend funding down the road on intervention.
Great. Well, thank you. I mean, it's a huge set of challenges. So I think in closing, let me turn to both of you, perhaps Rachel first with your last thoughts for new graduates who are certainly going to be starting their careers at an extraordinary moment.
Yeah, absolutely. So you are certainly graduating with the most relevant degree in the country right now, truthfully. And congrats on your impeccable timing and your choice for careers, because you are so incredibly needed right now. You've spent the last couple of years amassing your public health tool set, and you're equipped and ready really to go out and be public health problem solvers at a time when across our globe we are really faced with a public health problem of enormous scale. And this really weird spring will end up defining a decade and perhaps even a century. And you'll really be in this new workforce that jumps in and is ready to solve this crisis for our country and the globe. So congratulations to all of you, and best wishes going forward. We certainly need you, and we're excited to have you joining the workforce.
Great. Thank you. And Jill, let me turn to you.
Yes, I'll echo Dr. Herlihy in that we need you, and we are ready for you, and we can't wait to have you come work for us and join in this fight. If I was going to offer advice, it would be this: to never stop learning, to continue to hone your public health practice, and it is a practice. Keep up on the literature, be curious about the data, and always seek to understand the root causes and the big picture and best practices, and then go advocate for that, because the public is really depending on you.
Great. Well, thanks so much to both of you. Great words of guidance for our graduates.